And for example, under stress in the past month, have you felt sad, discouraged, or hopeless? Now, if you think about it, with yes-no type questions, there are three assumptions that are made very often in clinical dialogue. The first is the person knows the answer. Like, for example, and it may be the person may understand the question, such as a family history, but being an orphan, not know the answer. So we put in a maybe or don't know uncertain response. The second is the person understands the question. And it may be a bad question, so we can focus on questions that are consistently being not understood and change them. Or it may be a good question beyond the knowledge of the respondent, and then that should be a contingency to branch out and explain the meaning of the question. And hence, don't understand. And the third assumption is that the patient is willing to answer. And it occurred to me as a doctor that patients should have the equivalent of a Fifth Amendment. That it should be up to us as clinicians to explain the reason why we're answering, why we're asking the question, and how answering might be helpful to them in terms of their health and problems. But it should be their right, ultimately, to skip the question. And now it's rather not answer. And it's used very rarely, but patients have had told me that they really like having it there. They appreciate the offering of this response.